And as always, I'll be recording this training session so you can watch it in the training portal. All right, so welcome everybody. It's July 23rd, 2019. This is Christian, Advantage Medical Testing, and today we're going to be talking about the neurotransmitter retail panel. Now, you all know that we've got panels direct to consumer dealing with the methylation, the autoimmune, we got chronic pain, we got a men's health panel, developmental panel. Of course, that's for people with children with autism and adults with ADD. We've got a TBI and post-concussion panel. We've got the autophagy panel, which again, just to refresh you, is how our body detoxes itself at the cellular level. We've got the neurological psych panel. We've got the GI panel. We've got a women's health panel. We've got our own retail version of the PGX, which when insurance won't pay for it, we have an option for our people to get that PGX. And that autophagy panel, again, is our retail version of the CGX. So that's going to deal with cancers. So today we'll be talking about the neurotransmitters panel. So here we go. So first off, who needs the panel? All right. This is going to be for people that have friends, family, or themselves that deal with anxiety, depression, and bipolar, as well as cognition problems, memory problems, adult ADHD, children ADHD, insomnia, weight issues, hormone and adrenal dysfunctions, memory issues, and of course migraines and headaches. So let's talk about this panel here. It looks at 11 different SNPs. And of course, if you don't recall what a SNP is, that's a mutation in the gene, the polymorphism. So what's the goal of this panel? What will this tell the doctor? What will this tell the patient? Well, it's going to help the doctor and the patient manage or reduce their medications. And by manage medications, I mean makes the medications they're currently on more effective, may give the doctor some insight on some alternative medications as well. Also, we'll have the patient have a relaxed state of mind. All right, so let's go over really quickly like we love to do. Let's go over the mutations that this panel is going to look at. Pretty exciting stuff. The COMT, we've talked about this many times, but for this particular panel, we're going to look at the COMT mutation. Mutation here will relate to anxiety. All right, so if we have somebody with a mutation in the COMT gene, for this panel, it'll address the anxiety portion. Then we have the MAOA and the MAOB. And again, mutations in these genes often will indicate some depression. Now, depression and anxiety are the major components of this panel, so there's a lot of overlap with some of the genes from other tests, but you'll see why in a minute. The GAD1, my favorite gene. I have spent hours just looking at this GAD1 gene. As a matter of fact, this weekend, when I go to that convention I was telling you about, I've been asked to speak for 30 minutes on the GAD1 gene. And this thing fascinates me. Okay, this is dealing with our circadian rhythm. Again, but for this panel, it relates to the normal sleep patterns, relaxation. Also, mutations in this gene can indicate a low libido, some anxiety, and actually a seizure risk. All right, then we're going to go on down to the HTR2. That's going to relate to the serotonin. Now, serotonin, you guys need to look that up if you don't know what that does. It's very important for our bodies. Now, this HTR2 gene is actually the receptor for serotonin. This is the big daddy here, the HTR2 for serotonin. And mutations here can indicate all kinds of things, but primarily a depression. Now, we have our SLC6A4. Again, that relates to serotonin, and again, depression. Then we've got our TPH2, which relates to serotonin again, and that deals with anxiety, depression, and bipolar disorder. Now, the DBH, this one's a little bit different, but it relates to hypotension, cardio issues, ADD, HD, and autism. The MTHFR, this should be very familiar to you. This, again, especially in females, depression, anxiety, bipolar, schizophrenia, colon cancer, leukemia, chronic pain, and fatigue. Now, we go through all these genes, all these mutations, and the goal is not to have you memorize these things, but it's just to give you an indicator of why these panels are so important that when the results come back, that their doctors help them interpret the results. So let's go through a sample report really quick. This training today is going to be a little bit down and dirty because we got a lot of stuff to do, but here we go. All right, so you can see, again, with this report, green is good. We got the tan or yellow and a red. Remember, heterozygous and homozygous, remember those? Heterozygous means that we've got one dominant gene passed on from one parent, at least one, and homozygous means we've got a dominant gene passed on from both parents. So just because they have the yellow or the heterozygous result does not mean that they're for sure going to have to deal with these issues, but a red or the homozygous means that there's a very, very, very good chance that they'll have to deal with these issues. So if you look through here, everything's good in the GAD1, right? But we've got an issue with the COMT. So remember, our reports will reveal a therapeutic that's recommended. We've got a therapeutic that's highly recommended, and then a provider discretion as needed formula. Now, and then a lifestyle recommendation, right? And further testing recommendations. So when somebody gets the results of this report, there'll be a layman section for them, but for now, this is primarily meant for the doctors, okay? So the doctor should be able to interpret these results, but at Advantage Medical Testing, we offer the doctor an option, no charge to him. We put him in touch directly with the lab if they need it, and they can get some guidance on how to actually interpret these results and treat the patients. Another announcement here real quick is, like, for example, we see this recommendation here for this COMT, a provider discretion, this full focus. As of Monday, Advantage Medical Testing is able to offer these actual name brand supplements to the people at a pretty good discount, and it was like free shipping, and there's some other stuff here. But just know this, we're kind of a one-stop shop. So when they get the results of the reports, they'll be able to get these supplements directly from us, okay? So when the reports go out to the patients, they'll also get a coupon, and they'll also get directions on how to order these and how their doctor can order these supplements for them. They're pharmaceutical-grade supplements. They're not what you find at Walmart. They're very, very high-end and very, very reasonably priced. So as we get down here, the MAOB, we've got a little issue here, all right? And again, here's the recommendation, Mood Plus. Okay, now you'll notice there's not a highly recommended here because this person really is not in all that bad a shape. The MAOB, if you recall, it relates to depression. So this person may have issues with their depression, okay? So you can see this. Again, the things to remember about these reports when the patient asks, why am I paying you $250 or whatnot, is because you're going to get a therapy recommendation that you and your doctor need to discuss. There's highly recommended therapies that you and your doctor need to discuss. There's provider discretion therapies that you and your doctor need to discuss. And, of course, there's lifestyle recommendations that are for the patient to do on their own. For example, this one here, higher risk of depression, anxiety with stressful events. That's telling people to avoid them. Same down here. And then, again, the laboratory recommendations. So here's another one, test for them to consider. And down here, look at this, consider PGX testing. Okay? Down here we got the MTHFR, the Big Daddy, again, deals with methylation, so they're going to recommend a methylfolate plus. All right. Again, with the reports come a definition or an index for the patients to know what they're looking at, and also a gene index. So again, the thing to remember about these retail panels is this. You're not supposed to interpret the results of the patient because they'll get the results directly, just like the no-cost testing. They should take these reports next time they go to the doctor and bring them to the doctor, and the doctor can help them interpret them. Now, because insurance does not pay for these tests, the doctor can charge to the insurance company the consultation. Now, in the news here the other day, just yesterday as a matter of fact, the 123andMe health reports, they have now been approved by the IRS to be used with their health savings accounts, these health reports. So give it a couple weeks, and these people should be able to use our tests as well as part of their health insurance benefit and the health savings account. So there are some tax benefits to buy these things with their health savings accounts, and Advantage Medical Testing tests should fall in line with those as well. I'll put those announcements as they come. All right, so I'm going to go ahead and stop the recording, and then we're going to start taking some questions.